Introduction. The cerebrospinal fluid (CSF) plays a crucial role in the central nervous system (CNS), acting as a cushion for the brain, maintaining intracranial pressure, and removing waste products. Understanding the dynamics of CSF flow is essential for diagnosing and managing various neurological conditions. In humans, it is well documented that factors such as body weight, age, and sex can influence CSF flow. However, similar studies in dogs are limited. This study aims to fill this gap by investigating how these factors affect CSF peak flow velocity in dogs without neurological disorders. Background and significance. The brain and spinal cord are bathed in CSF, a clear, colorless body fluid produced in the ventricles of the brain. CSF circulates through the ventricular system and the subarachnoid space surrounding the brain and spinal cord, providing essential mechanical and immunological protection to the brain. In veterinary medicine, precise assessment of CSF flow is vital for diagnosing conditions such as hydrocephalus, where an abnormal accumulation of CSF occurs, and Chiari-like malformations, which involve the displacement of brain structures. Identifying normal and abnormal CSF flow patterns helps in early diagnosis and treatment planning. Thus, understanding how normal physiological factors like body weight, age, and sex influence CSF dynamics is fundamental for accurate clinical assessment. Methods, study design and participants. This study was designed as a prospective cross-sectional analysis and received approval from the Cantonal Veterinary Office of Bern. We recruited 46 client-owned dogs over 22 months from the Vetsus faculty of Bern. Inclusion criteria stipulated that dogs needed to undergo general anesthesia for non-neurological reasons, while exclusion criteria included abnormal neurological examination findings or a history of neurological disorders. Ultimately, 32 dogs representing a variety of breeds, ages, and sexes met the study criteria and were included. MRI protocol. MRA scans were performed using a 1.0T unit. Dogs were positioned in sternal recumbent sit and phase contrast MRI. PCMRI was utilized to measure CSF flow. PCMRI is a technique that enables quantification of fluid flow velocities and is widely used to study CSF dynamics. CSF flow was measured at 3 anatomical locations. 1. The mesencephalic aqueduct. 2. The foramen magnum. 3. The second cervical vertebral body C2. For each location, appropriate velocity encoding VANC settings were chosen based on expected CSF flow velocities to avoid aliasing while maintaining adequate spatial resolution. Data analysis. CSF peak flow velocity, defined as the maximum velocity of CSF during the cardiac cycle, was calculated using dedicated software. Measurements were taken from 3 points within the CSF spaces and analyzed using linear regression models to compare CSF flow between different groups based on body weight, age, and sex. For the analysis, body weight was categorized into numerical and categorical variables, and age was divided into groups. Results. Influence of body weight. Body weight significantly influenced CSF peak flow velocities. Dogs weighing more than 20 kg exhibited higher CSF peak flow velocities compared to dogs weighing less than 10 kg, particularly at the foramen magnum and C2 levels. This finding is consistent with the notion that larger body size may result in higher fluid dynamics within the spinal canal and cranial cavities. Influence of age. Age also had a significant impact on CSF flow. Dogs aged 2 years or younger demonstrated higher CSF peak flow velocities at the foramen magnum compared to older dogs. This result suggests that younger dogs might have more dynamic CSF circulation, which could be attributed to developmental factors and higher metabolic activity. Influence of sex. Sex differences were observed in CSF peak flow velocities. Female dogs exhibited lower CSF peak flow velocities at the foramen magnum compared to male dogs. This difference could be due to variations in hormonal influences or anatomical differences between sexes. Discussion. The results of this study highlight that body weight, age, and sex significantly influence CSF peak flow velocity in dogs. These findings have important implications for veterinary neurology, particularly in the assessment and diagnosis of CSF-related disorders. For instance, recognizing that larger dogs naturally have higher CSF flow velocities can help avoid misdiagnosis of conditions like hydrocephalus. Similarly, understanding age-related changes in CSF dynamics can aid in distinguishing between normal developmental variations and pathological conditions. Implications for clinical practice. For veterinarians, this study emphasizes the need to consider these physiological factors when evaluating CSF flow in dogs. Adjusting for body weight, age, and sex can improve the accuracy of diagnostic imaging interpretations and lead to better clinical outcomes. Future research should focus on establishing reference ranges for CSF flow velocities considering these variables, which could further refine diagnostic criteria and enhance the precision of veterinary neurological assessments. Future research. Future studies should investigate the underlying mechanisms driving these differences in CSF flow dynamics. Additionally, research could explore how these physiological factors influence the progression and treatment response of CSF-related disorders in dogs. Longitudinal studies following dogs over time could provide valuable insights into the natural changes in CSF dynamics associated with aging and development.